In this morning's Health Watch, when to call in sick. For most of us, even if you're feeling lousy, the instinct is just to get out of bed and go to work. But it is sometimes better for you to stay home until you're better, for the sake of everyone else around you. Dr. Jennifer Ashton is here this morning with some answers. And I know this is one of your pet peeves because we've talked about it a lot.
Yes, it is. So many people they're afraid to call in sick.
Yeah.
They can't call in sick. They feel like their job really depends on them. Your job actually depends on you being there and being healthy and functional and doing the best job you can. Sometimes you can't do that when you're not feeling well.
So if you're not feeling well, whether it's, headache or chills or runny nose or your throat hurts, you have some questions that we should ask ourselves that will basically help us determine whether or not we should stay home.
Exactly. And the first one is so basic, Erica. It's, are you contagious? Now, if you're talking about an upper respiratory infection like the cold or flu, obviously the answer is going to be yes. If you're not feeling well, then you are, by definition, from an infectious disease standpoint, contagious.
Okay.
Certainly if you have a gastrointestinal virus or bug, vomiting, diarrhea, by definition, you are contagious. And by going to work, you are exposing your coworkers, and in some cases, let's say you're a doctor or nurse, your patients to the same infectious disease that you have. Not a good idea.
Not a way to make friends.
Exactly.
You say we should also take a look at the situation and determine whether or not rest will help you get better.
That's right. So that's really the second question is, will you be better if you spend one day not going to work, staying in bed, and really just letting that infection run its course? And for the most part, the answer is usually yes. And the last question, which is a really important one, is, are you on medication that will make it dangerous or for you to go to work or impair what you're able to do? A lot of times, common cold medications or over-the-counter pain medications or prescription pain medications can really make going to work, especially if you drive there, very dangerous.
You also say once you do determine you're sick, what are the things we can do? One of the most important is to drink a lot of fluids.
Most important thing, if you call your doctor and say, I think I have a cold or I think I have the flu, they're going to say, stay in bed, hydrate yourself, drink a lot of fluids, chicken soup, and let it run its course. That is key because you can really get dehydrated, certainly when you have a fever, and so replacing those fluids is important.
What about when, especially in the wintertime, you get a runny nose, you're not sure if it's a cold, you're not sure if it's a sinus infection. How do you know the difference and how do you treat that?
Well, we usually go by two things, Erica, because a lot of common colds do then segue into bacterial infections. For sinuses, you talk about two things. How long have you had it, if it's lasting more than 2 weeks? And is it green? And if it is, you need antibiotics.
All right, great advice as always, and never forget the hand sanitizer, which I know is your favorite.